In this I'll set total 10 set. I'll put 15 sets in total. I'll put total 3 minutes. So all these are not actually required. You'll study it one or the other place. So there are many things that are not required. So if you ask me in total in these 2 pages, what was the most important thing? Okay, coaching platforms, rapid revision is still bulky for students, so you can't revise. There are only 2 sources right now in market which you can revise in last 10 days. Haloperidol, yes, I'll remember. Thiotixin is not a commonly asked, so I'll not remember. So my 2 minutes are done and I've done 1 full page. Now my next 2 minutes will start now. So hello everyone, I'm Dr. RMD. With last 3.5 years of experience mentoring students, guiding them and bringing them to success in NEET PG, the most common query that I get nowadays is not about, sir, what is the strategy, how to study for next 3 months, NEET PG is only in 3 months. The most common query, however, is how to concise notes so that you can revise in last 10 days. So the problem earlier on was that people used to study from main videos and main notes, okay, or they used to attend live classes. So these notes used to be bulky, they used to be very without images, because you used to make your own notes and you didn't know what is important. There was no highlighting also. So this is the traditional method, okay. So the problem was to concise these notes, okay. This is one category of student who actually have attended live classes, who have attended main videos, okay, and they don't know how to concise their bulky notes, okay. Second category of students are who have used short-term revision courses, and these include short-term revision courses include rapid revision and BTR. So BTR is anyways condensed, so I don't have to explain it because you can cover it in last 10 days. But what about rapid revision? Most of the coaching platforms, rapid revision is still bulky for students, so you can't revise. There are only 2 sources right now in market which you can revise in last 10 days. That is, one is BTR, another is hyper revision course of cerebellum, and one more is which to some extent you can revise, that is DVT. Okay, these 3 resources you can revise actually. So what about rest of the sources? Unless you have got 3 revisions thoroughly and you are a fast reader, if these 2 are met, you can revise. Otherwise, you can't revise in last 10 days. So for those students, this category 1 and category 2 students, I'm going to discuss how to concise notes. Okay. So first we'll come to students who are using rapid revision. Okay. So rapid revision students, there are 2 categories. One is who made their own notes. Okay. Who made their own notes, and second is the students who have ready-made notes from coaching platforms. Now most of the students will fit into this ready-made coaching notes because you already have notes, you have highlighted some things. So let me show you an example. For an example, I have taken this notes from Marrow, which I was using. This is actually edition I think 6. So this is actually main notes. I'll say you similar thing only you'll have to do in your revision notes also. So you see here, this topic antipsychotics in pharmacology is very important. Okay. So how, if I were in your place, what would I have done to concise these notes? First thing is, you'll see this green letters and red letters, right? Those are the ones that are important. So first, for example, antipsychotics, I'll see how much pages they are. Okay. So antipsychotics is in total, yes, around 10 pages, I think. Yes, 8 pages. Yes. Sorry, 1, 2, 3, 4, 5, and 6 pages. So what I would say is, if it is a really important topic, you should not dedicate more than 2 minutes per page. 2 minutes per page is more than enough. Okay. Ideally, it depends on something known as time-based constraint method. What it is, I'll tell you. Okay, I'll tell you time-based constraint method also. I'll tell you what is PYQ-based constraint method also, because these 2 methods, okay, that is, one is time-based constraint method, time-based constraint, and second is PYQ-based constraint method. These both methods are going to be useful for concising our notes. I'll tell you exactly. I'll give clue using Marrow Pharmacology main notes. Okay. Marrow Pharmac main notes I'll be telling you. So this is old edition which I had used during my time. Okay. So what is time-based methods? So let's say you have got from MedPath website. I think by now you know what is MedPath. So MedPath is a website, my website. Okay. If you search in Google MedPath, it will create you customized planner according to topics. Okay. It's free of cost. You can utilize it. Okay. Link is below in the description. Just go and search in my website, drrmd.in. rmd.in. Okay. Just go there and search MedPath. It's a free study tool which will give you your personalized timetable, and it's much better than revision planners. It is much better than any realistic timetable that we have currently available in the world. There is no such timetable planner like MedPath. Okay. Yes, so MedPath will tell you, for example, CNS of Pharmac, you have to complete in 2 hours. Okay, that is your target for today. So based on this, you realize that antipsychotics, you can give only 15 minutes. Okay, so 15 minutes for antipsychotic it means that you have to finish antipsychotics, total 15 minutes, you have 6 pages. That means one page you will get around 2 minutes, maximum 3 minutes, so 2 to 3 minutes. So what you will do, you will put a timer, and which timer you will put? You will put timer. There is an app known as interval timer. Now I am not promoting any app, but I found this very useful for my MD preparation. So this interval timer, you can create sets, repetition sets of 2 minutes or 3 minutes. So every 2 to 3 minutes, it will I'll show you exactly how it is done. So this is my interval timer app. In this, I'll set total 10 sets. I'll put 15 sets in total. I'll put total 3 minutes. Okay, one set for 2 minutes. Okay, we'll put for 2 minutes only, and I'll show you how it works. So every 2 minutes it will start a bell. Okay, so now it has started. Okay, so my 2 minutes will start now. So in this 2 minutes I have to finish one page. Okay, so let me go through first page, that is antipsychotics. I know what antipsychotics are. Now what is it related to? Dopamine. That is, there is increased dopamine in patients of psychosis. So I got to know that increased dopamine causes psychotic symptoms. So we have to block dopamine receptors basically. So we have to block dopamine receptor, that is D2. So it blocks generation of action potential in the neurons. Okay, this and then blocks thought. That is, all processes will be blocked. Okay. So what antipsychotics do? Antipsychotics blocks this D2 receptor. Understood? Because increase in dopamine is what is causing psychosis. So what are its uses? Simple. What is written in blue and green and red is important. So it blocks D2 receptors, is a mechanism of action of typical antipsychotics. What is its use? Schizophrenia. Schizophrenia, it is second line drug, not first line. I'll remember this because I also want to know what are first line drugs are. And it is effective for positive symptoms of schizophrenia. Next, antiemetic. All have antiemetic action except thioridazine. Okay, I'll just remember this. I'll put a star mark over here so that I don't forget this in my future revisions. And it has also antipruritic action, that is H1 receptor action also. Okay, fine. Next, how do I classify it? It is very important. So I'll classify as low potency and high potency at dopamine receptor. Next, low potency is molindone. I have not heard of this drug, so I'll not even remember this. Phenothiazines, yes, I'll remember. Thioridazine, yes, I remember. It has no antiemetic action. Yes, I remember now. So it is a class of low potency typical antipsychotic. Okay, and next we have high potency, and in that we have fluphenazine, perfenazine, trifluperazine. Now I'll just remember fluphenazine. Okay, rest all are phenazines, so I can remember from that, phenazines or penazines. Okay, similarly haloperidol, yes, I'll remember. Thiotixin is not a commonly asked, so I'll not remember. So my 2 minutes are done, and I have done one full page. Now next, my next 2 minutes will start now. So typical antipsychotics, what are the side effects? So these are basically the receptor actions other than the normal action. So D2 side effect, we know that dopamine's antagonist is prolactin. So if dopamine decreases, prolactin will increase. Yes, I got my one MCQ point, that is hyperprolactinemia is a side effect. One more is extrapyramidal side effect, repeatedly asked MCQ. What are the other receptor actions? So all these things, no, I won't see much. I'll just see what are the side effects, because this can be asked in antipsychotic overdose. So constipation, dry mouth. So what I'm saying is basically these are anticholinergic actions and antihistaminic actions. So if I know what is anticholinergic, what is antihistaminic, I can remember. Third important thing is metabolic syndrome, and all this maximum, minimum, I'll not remember as such. If any question comes on this, I'll remember. But extrapyramidal symptoms, I'll definitely remember. That is haloperidol and thyroidism. Maximum is by haloperidol. Only this one point I'll remember, and I'll put in star mark. That's it. I'll go to next thing, that is extrapyramidal side effects. Same thing. This only has continued over here. So which are the extrapyramidal side effect? Akathisia. Akathisia means restlessness. So what is the drug of choice? Beta blocker. That's it. Acute dystonia, muscular contraction occur, dystonia, so okay, tone difference. Okay, so this is the earliest extrapyramidal symptom. I'll just remember that much. Then Parkinsonism can also occur because it blocks dopamine receptors. What is the drug of choice for all this? It is anticholinergic, because this antipsychotics decrease acetylcholine because they are anticholinergic. So we give anticholinergic, which are the drug of choice. Okay, anticholinesterases. Okay. Next, which are the examples? Benzexol or trihexyphenidyl. These two are enough for me. And then H1 receptor antagonism with maximum. Okay, I won't go through all this because this is not at all important for me. So 2 pages I have completed in just 4 minutes. I have like that only 2 more minutes to go, and I'll be able to finish everything within next 6 pages within 12 minutes. So after 12 minutes, I have this 3 minutes extra. No? In that, I'll go through any doubts if I have. Now you'll ask me. Now I'll tell you exactly where students make problem. Where students make problem is point like this. Like for example, you will go through your notes and you'll see H1 receptor antagonism with maximum anticholinergic effect. So all these three. Now I'll ask you, why is it required? Is it required? What is required in MCQ? Will anyone ask which H1 receptor antagonism with maximum anticholinergic effect, which this one is there. So all these are not actually required. You will study it one or the other place. So there are many things that are not required. So if you ask me in total in these 2 pages, what was the most important thing? Okay, when you solve PYQs, you'll actually understand because you have to solve questions for that. What is the most important? If I condense everything and ask you 5 questions, this is what you should do after studying everything. 5 important questions from this. That is, one is, what is the mechanism of action of antipsychotics? Second is, in typical antipsychotics, what is the main use? That is, schizophrenia, it is used as second line of drug. That's it. Even this antiemetic action by thyroidazine is not important. Third is, which are the low potency one, mainly thyroidazine, which is high potency one. All these 4, that is only thing you should remember. Next, fourth point is, what are the side effects? That is, one is metabolic syndrome side effect is there. Second is anticholinergic and antihistaminic side effect is there. And third is this hyperprolactinemia and extrapyramidal symptoms. Now, extrapyramidal symptoms are very important out of this. That's why I'll definitely go through akathisia, because many questions are asked on this. One, what is akathisia? Second, what is acute dystonia? What is the drug of choice for akathisia? It is beta blocker. It is not anticholinergic. What is acute dystonia and Parkinsonism, and what is the drug of choice for that? This much is more than enough if you know, and you should know how to apply it in your question. So getting my point, this is how you condense notes. It is not like okay, that was 1 more minute for us, 1 more 2 minutes, the bell that comes in this interval timer app. Okay, so this is how you condense notes and go ahead, but I'll tell you how you guys read. Okay, I'll tell you that also. Let's say, for example, you are going through this part. Okay, let's say this is from your revision notes, for example. Okay, you will say tardive dyskinesia. Okay, occurs after many years due to upregulation of D2 receptor. You will highlight this, you will do something with this. Okay, you will put highlight marker on this. Okay, I know, because I have been interacting with students for a long amount of time, and in online consultation you will be telling me the same thing. Okay, then after that you will think, what is the meaning of upregulation of D2 receptor? I have not heard this. No, downregulation, upregulation. So you will go to Google and search what is upregulation, and then you will write, you will put a small box and you will write upregulation means increase in receptor number. See, now how much time you wasted? You wasted 1 minute for this unnecessary information. Even if you did not do also, what was the use? Nothing. Only one thing was useful in this, that is, it occurs after many years. That is, tardive dyskinesia is a late side effect. Second thing that is required is, what is the treatment for tardive dyskinesia? That is deutetrabenazine and valtetrabenazine, and they block which receptor? VMAT. Done. What is VMAT? How it acts? All those are not required. You just should know what is the mechanism of action of the drug used to treat tardive dyskinesia. That's it. Then next is neuroleptic malignant syndrome, very commonly asked. So you should know what is the clinical feature, because this can be asked as MCQ. So these are the clinical feature, and what is the treatment for it? Dantrolene. What is the mechanism of action of dantrolene? It blocks ryanodine receptors. And what is the most specific drug for this? It is bromocriptine. Now you don't have to know what is bromocriptine, how is it extracted, which plant it comes from, or what is its mechanism of action. All this you don't have to know. You should just remember these many things. Only then your revision will happen. Next, same thing. What are the other side effects? See, all these side effects you don't have to know, unless for thyroidazine, which cause, okay, you can know this. There are some off-tal side effects which can be asked. So thyroidazine, what do we know so far? We know 2 things about thyroidazine. One is, it is low potency drug, low potency typical antipsychotic, and second, we know that thyroidazine has no antiemetic action. Okay, so these 2 things we know. Upon that, we know that it causes brown vision, retinal deposit. So some off-tal effects are also there for thyroidazine. Next category of drug is the serotonin hypothesis is there for this one. Okay, so I'll go through all this typical, and then I'll go through atypical antipsychotics. So now I'll remember things like schizophrenia, second line of drug was typical antipsychotic, but atypical antipsychotics are the first line of drugs. Okay, so atypical antipsychotic, what is the mechanism of action? Because it blocks 5-HT2 receptor more than D2. This is the most important differentiating feature. If you don't know this concept, and even though you are reading revision notes or BTR, then what is the use if you don't know this simple thing? So where is it used, in which conditions commonly? So in depression, add on except quetiapine, not required. Okay, unless it is a specific PYQ, otherwise I won't go into depth. So levodopa induced psychosis also I am not worried much. Autism associated irritability also I am not worried much. Not FDA approved, then what is the use of learning that? Okay, so I'll skip things which are not required. Now you will ask me like, sir, how do you know which is important and which is not? Everything is based on PYQs. So whatever is asked in PYQs or can be asked as a PYQ, that is upcoming question, sorry, but whichever can be asked as FYQ. FYQ means future year questions, that is what are the predicted questions, those are important. Rest all things. Now who will ask you which are the drugs used for levodopa induced psychosis, or for autism associated irritability, which drug will you use? All these things, no, not at all important. Okay. Next, clozapine. Now, why clozapine is asked? Because of one thing, that is, it has increased risk with HLA DQB1. Now, even if you don't remember everything, it's okay, but you should know there is some genetic defect associated with it. Second is, it has very common sedation effect. And third is, it is the most effective antipsychotic used for resistant schizophrenia. And it is used for resistant schizophrenia. Okay. So, yes, next, it is contraindicated with carbamazepine. 2-3 things. Therapeutic drug monitoring is required. This myocarditis, de novo seizure, not at all needed. No one is going to ask you. Sialorrhea, yes. So the easiest method, no, if you see this entire flow chart, the easiest method to point out what is important is just follow red and green. That's it. So red, drug of choice. Clozapine is the drug of choice for resistant schizophrenia. Got my point? But treatment of choice is electroconvulsive therapy. That's it. Which are the drugs which decrease suicidal tendency? Out of that, one is clozapine, one is electroconvulsive therapy. Along with that, one more you remember, lithium. Okay, clozapine causes agranulocytosis, and highest risk is with this. It also causes sialorrhea, which has wet pillow syndrome, and its most common side effect is sedation. If you remember this much, it is more than enough. And I bet you, even if you read main video notes of Marrow, if you use the technique that I have used currently, you will definitely finish revising this in 4 days. Just 4 days. You will finish entire pharmac. It is not at all difficult. The problem with students is you will go through unnecessary things which will consume a lot of time. Like for example, I told you, right? You will go through this de novo seizure. Why? That is my question. Therapeutic drug monitoring cannot be done. Why do you want to know? Okay. Next, myocarditis. Why? Because there are many common causes of myocarditis. Who is going to ask you rare cause of cardiomyopathy? Cardiomyocytes, that is also clozapine induced. No one is going to ask you. There are many other important things to finish. Similarly, quetiapine, very important thing is it can be used as monotherapy in depression. Otherwise, you always give add-on therapy, but here you can use it as monotherapy. Next, side effect, QT prolongation, but maximum it is not with quetiapine, it is with ziprasidone. That much you have to remember. Next, overall QT prolongation, typical causes more QT prolongation than atypical. You are studying about QT prolongation here because quetiapine is atypical, but still you should know that typical has more tendency to cause QT prolongation than atypical, that is quetiapine. That's it. Next point is risperidone. Maximum, what is the only thing you should know? Hyperprolactinemia. Now, if you remember House MD, there is one episode where galactoria case is there. Okay, he gives risperidone, and there are some breast nodules which are there in the behind the knee, and in that there is galactoria because of prolactinoma. Okay, hyperprolactinemia. So try to correlate such things. Okay. So next is like aripiprazole and brexpiprazole. Okay, and what is it? If you remember this much, it is enough. That is, it is a partial agonist. At which site? That much is enough. All this least weight gain, all this I don't think it is important also. So typical antipsychotic side effect we already saw. Okay, that's it. Your antipsychotics is done, and this is not from revision notes. This is from main notes, and the entire duration of video is just 20 minutes so far. And in that also first 5 minutes I gave introduction. In less than 50 minutes you covered everything related to antipsychotics. So this is what is required to prepare for your exams. So why are you confused? Okay, so this is one method. Okay, this is called as time-based constraint method. So this is what is time-based constraint method. Second is PYQ-based constraint method. So let's say you are a person who wants to study everything in depth. Okay, you are a person who wants to study everything in depth. So you didn't like my idea. Okay. So now you have one more approach, that is PYQ-based, and this holds true for students who are like studying from main notes. Okay, especially now. Parkinson's disease is a repeatedly asked PYQ. So what you will do, you will star mark it and you will study everything under Parkinson's. Okay, levodopa is also important. On-off phenomenon is important. You can't leave anything from this. So this method you will use for high yield topics only. Like MAO-B inhibitors also you should study everything. COMT inhibitors also. So basically Parkinsonism you have to study everything because anything can be asked. But let's say one more topic, that is for example over here, yes, affect disorder. Okay. In affect disorder, monoamine hypothesis is not at all a previously asked topic. So what I'll do, I'll take PYQ list, okay, whichever question is asked. Let's say my first question was on Parkinson. So whatever is related to that, I'll study. Let's say it was asked on Parkinson, it was asked about, let's say levodopa was asked. So what I'll do, I'll come to selectively levodopa topic and I'll study everything which is given under levodopa. On and off phenomenon was asked, let's say, in next exam, that is 2024 NEET PG. So I'll come to on off phenomenon. I'll study whatever was there under on and off phenomenon. Okay. Similarly, let's say the third question was about drugs acting, okay, was about parasympathetic nervous system and acetylcholine. So I'll just study selectively acetylcholine, but I'll not study anything else. So in this manner, from your notes, if it is 100% of your notes, you'll be able to concise your notes to 40% just by selecting previous year topics only. Rest all things will leave, like ANS introduction. Why do you want to study? Because you already know, you'll study it in physiology, you'll study it in medicine, you'll study it in patho, wherever you want, you'll study. But why do you want to do it again? Similarly, what is drug? What is the source of drug? Why? You can just leave all these things, no? So what we'll do is, like, absorption of drug is also not important. Carrier mediated transport, you already know. This one is important, that is P glycoprotein. Okay, first pass metabolism, which are the drugs. So this will be important. So actually based on this, PYQ is there. So you will selectively solve whichever topic comes under PYQ. Okay, like passive diffusion, you already know what is the use of this, no use. So if there is a PYQ asked on, let's say, bioavailability, yes, that time you will study entire bioavailability till here. Okay, and let's say next question was asked on apparent volume of distribution. So you will study only apparent volume of distribution. You won't study everything because you are studying only things that are asked as PYQ. This is known as PYQ based concision method. So this is known as PYQ based concision method. Okay, so now some people will be there who are like, sir, you have told all this, but even to read this also it takes so much time. In last 10 days, how can you revise? So last 10 days, for those people who are feeling how to revise, how to concise note, there is something known as a sticky note method. Okay, sticky note method. So what is the sticky note method? See, let's say you have this in every page. Okay, you will paste a sticky note. Okay, I don't have sticky note with me, so I can't paste it. So basically in this, you see apparent volume of distribution is asked. Okay, let's say you are forgetting the like formula for apparent volume of distribution. So what you will do, you will write it over this sticky note. Apparent volume of distribution is equal to dose of drug divided by concentration of drug. That's it. Next, if you give through any other route, this is for IV route. If you give through any other route, then apparent volume of distribution is equal to dose divided by concentration into bioavailability. Okay. Next, lipid solubility is directly proportional to volume of distribution. Okay, so basically you will write only 5 points which you are going to forget and is very important. So on the day of exam, one day prior to exam, or maybe in last 1 week, you will not read entire notes. You will read each page sticky notes that you have attached. So this is the sticky note for this particular page. For next particular page, I'll do a sticky note over here. Okay, so my first point will be plasma protein binding is inversely proportional to volume of distribution. Second is digoxin has high tissue binding. So tissue binding, so it has a high loading dose. Okay, high loading dose is required. It requires loading dose. Okay, it requires loading dose because of high tissue binding capacity. Next, drug toxicity. Now I want to know which are irreversible. What is the antidote? So I'll write out of this, most important is one is benzodiazepine flumazenil. Second is beta blockers glucagon. Third is digoxin digiband. Opioids naloxone you'll however remember. Organophosphorus atropine you however know. So calcium channel blockers, calcium gluconate. So these 4 points, no, you'll selectively write here. Antidotes of these 4 drugs are. So this sticky note will take you just some 1 minute to read. That's it, maximum 1 minute, not more than that. So in this way you can concise everything in this sticky notes, whatever there is in the page. Not everything, just see how much will be a sticky note. Sticky note will be just like around how much, maybe some 7 centimeter into 7 centimeter, something like that. Okay, yes, around 7 centimeter into 7 centimeter. So in that 7 centimeter into 7 centimeter space, whatever you can write, you write, because you can only revise that much in the last day. That is the whole concept of sticky notes. Okay, so these are the 3 methods I have already discussed to concise your notes. One is time based constraint method, which you use during interval based timer app. Second is PYQ based concision method. This is for most important topics so that you don't leave out any important topics. And third is sticky note method. Okay, this is for last 1 day revision. If you follow this, now it will be easy for you to revise notes in your subsequent revisions. Now how many revisions you have to do total? You have to do total 3 revisions. Now how to do all these 3 revisions? You have this MedPath website which will generate you your own customized timetable whenever you want. It is a free tool also. If you haven't used MedPath so far, go to your website, type drrmd.in. In that you click on explore MedPath and you go there, enter which phase of revision you are in, whatever. Yeah, it is not like a fixed schedule. It is flexible according to your need, how many hours you want to study. It all depends on that. Okay, so inculcate this process and it will make your study a lot easier. So thank you.